My names are Hezron Chakanika. I'm from Zambia and I'm 42 years old. Just from having a major heart surgery, I'm getting stronger by the day. I think the heart palpitations and specifically the chest pains, away from the sore of course, are not there anymore. I've started doing my physiotherapy, I'm walking. From the time I came, the time I had the surgery, and this time that I'm ready now to be discharged. I actually grew up with the disease known as rheumatic heart disease from as far back as I was young, but it was not symptomatic. So I was on long-lasting penicillin till recently when I started experiencing shortness of breath, a bit of chest pains. So with those symptoms, my first experience with Wockhardt Hospital was quite tremendous. Of course, before I came through, my thoughts were that I would have to first check into a hotel, do the paperwork for a day or two before I go to see a doctor. But to my amazement, when I got here, I found transport was already arranged for me. Apart from that, the transportation brought me straight to the hospital, and within 15 to 30 minutes, the paperwork was done and I already had a room. So I was quite impressed with that.
He had a problem of breathlessness and walking, even a small distance. So with this age of 42, he could just climb, 1 or 2 floors at the max with the difficulties, and also having the palpitations. So comes to in treatment, he has been treated medically there. So that was, I think, we should avoid. In the cases of the valve, it is always better to approach the surgical aspect more, whether valve can be replaced. But just by giving a medical management for a longer time is going to, damage the heart more rather than giving you much benefit. The good thing about our institute is we try to do most of the valve cases by small minimal incisions, so where the patients can go home on a day 3 with all the activities. Because in this case, because of his more valve problems, one of the pressure has gone up. So that can be one of the contraindication for the minimal invasive. We haven't transfused him. That is a good thing, because the transfusion has itself its own drawback of infections and other things.
There are some issues that were not highlighted in Lusaka.
We just wanted to say thank you for the first-class experience that Wockhardt Hospital has given us. From the entrance, the security men, to the elevator guys, housekeeping, the doctors, the nurse stations, everyone has been absolutely brilliant.